Menopause marks a crucial milestone in a woman's life and signals the end of the reproductive life cycle, usually occurring between the ages of 45 and 55 years. Women experience wide-ranging symptoms, including sleep disturbance, bone loss, brain fog, weight gain, anxiety, depression, and fatigue. Hot flushes are one of the main symptoms and are experienced by up to 80% of women and can last for several years. Hot flushes are extreme thermoregulatory events, typically associated with an intense feeling of heat and profuse sweating, which can last from a few seconds up to several minutes, and have a severe impact on one's quality of life. Hormone replacement therapy via tablets, patches and gels can help to alleviate hot flushes, but is not suitable for everyone. Other therapies can include the recently licensed drug fezolinetant, but this is not yet widely available, and some women are helped by herbal remedies and cognitive behavioural therapy. Many women continue to suffer hot flush symptoms due to a lack of therapies and an incomplete understanding of the physiological mechanisms responsible for hot flushes. Research has suggested mechanisms related to a lowering of the temperature threshold for sweating to be activated in some menopausal women, whereas other studies suggest changes in the hypothalamus, the brain's thermoregulatory centre, that trigger hot flushes. These represent central mechanisms, but we don't yet know whether local changes in peripheral sites, such as the skin, can contribute to hot flushes. For instance, do menopausal women who experience hot flushes exhibit greater responsiveness of the skin blood vessels and sweat glands? This novel research aims to examine the function, or responsiveness, and structure of skin blood vessels and sweat glands in pre- and post-menopausal women. 4 groups will be recruited in a parallel design: healthy premenopausal women aged 18 to 30, healthy premenopausal women aged 31 to 40, and healthy postmenopausal women aged over 45 and not on any treatments will be recruited and divided into whether they experience hot flush symptoms or not. Participants will visit the lab on 2 occasions. Visit 1 will involve a blood test to determine estradiol and circulating biomarkers, and this will be followed by a technique called cutaneous microdialysis, along with capacitance hygrometry, to assess skin blood flow and sweat rate. This will be achieved using bespoke capsules that collect moisture and also house laser Doppler probes to detect moving red blood cells. 3 very fine membranes will be placed just beneath the forearm skin, which will then be perfused with increasing doses of vasoactive drugs to provoke skin responses. Following this, dose-response curves will provide between-groups analysis of skin function. At visit 2, participants will undergo a forearm skin punch biopsy following a local anaesthetic. This tissue will be sectioned, stained and imaged to quantify the number and size of blood vessels and sweat glands. Between groups analysis will enable us to examine differences between groups. For instance, do symptomatic females exhibit a greater number of blood vessels and/or sweat glands, or are they larger in size than those in women who do not experience hot flushes? The findings from this novel research will reveal important insight as to whether there are subtle changes in skin function and structure associated with ageing, and whether such local changes in peripheral sites, such as the skin, contribute to the occurrence of hot flushes, such as an overt sensitivity to vasoactive substances. Observation of any such changes would increase our understanding of the causes and side effects of hot flushes, and have important implications for patients and clinicians by helping in the design of effective treatments to manipulate the activity of key mechanistic drivers via pharmacological and non-pharmacological methods.